morning and welcome. I am Senator Kevin Kelly, the Senate Republican leader, and we're here this morning to talk about a better way to affordable health care in the state of Connecticut. For working and middle-class families, Connecticut is anything but affordable. And one area in particular is our health care. And it doesn't have to be so. We can do better, and that's what our proposal aims to do. There were promises of the Affordable Care Act that we would have affordable health care, better access, and improved quality. And for the past 10 years, Connecticut families have experienced anything but that. People are taking it on the chin every day, and family budgets, their kitchen table economics, are breaking. Our overly complex healthcare system does not work for the patients. And this picture right over here demonstrates that. You see everybody is here, and all these middlemen add cost. What we really should have are prescription drug manufacturers to a pharmacist to the patient. But the system is laden with middlemen, gatekeepers, if you will, that add cost. So to that effect, we have proposals that would actually
the Human Services and Aging Joint Public Hearing is now located in hearing room 1E.
So we have proposals that will actually like Groundhog Day. So we have proposals that will actually reduce the cost of healthcare premiums. These have been vetted, they've been looked at. The Wakely report several years ago found that we can reduce premiums by 30%. That's an annual savings to the average family of four of $7,000, almost $600 a month. Imagine what that could do for a family budget that's breaking. That's real money that can be saved. And this is a proposal that not only provides real money, but it also keeps good paying Connecticut insurance jobs right here in the insurance capital of the world. So that's what we've proposed. And I'm going to turn it over now to our ranking member on insurance, Senator Tony Wong.
Thank you, Senator Kelly, and it's an honor to be here. And based upon the crowd that's here and the interest, healthcare is important to everyone. That being said, affordability is also a significant issue. We have an unaffordable Connecticut, and health insurance costs that have risen in such double digits numbers in the past number of years consistently is truly unaffordable. The Senate Republicans have solutions, one of which is to reduce the cost of health care. We've heard from the governor as well as the Department of Insurance cost driver analysis. We're offering solutions in this package. I think the first one is to feed on the benchmarking process that we have passed in the past few years, but to also not just apply from a data collection of services, but to also ask for benchmarking from our hospitals and from our pharmaceutical companies, because those entities are significant cost contributors. So we're going to expand the benchmarking not only for procedurals, but to ask our hospitals how they do business and ask our pharmaceuticals and how they do their business, to ask for greater transparency. Another area of importance is transparency in two major cost areas. Our pharmacy benefit managers, the middle person that administers our pharmaceuticals to the various pipelines that utilize pharmaceutical services. PBM has been a vertical integrated with many of our insurers. They create formularies that dictate the use of pharmaceutical products. But we really have very little transparency on that. We really have very little understanding on how their spread pricing, their utilization of coupons and rebates affect the price of prescription drugs. And we're also going to ask our pharmaceutical companies to create a greater transparency in how they price their products. So I think in this area, we can reduce cost by driving down greater transparency. Another area is looking at premium solutions. You had talked earlier from the standpoint of the savings that are provided to Connecticut households in reinsurance. It is a utilization, it is a product that's been used by many insurance industries that we should be utilizing, using some of our surplus funds as well as federal funds to be able to dilute the insurance cost that is passed on to the consumer. It has been shown, as Senator Kelly mentioned, the Wakely report that was commissioned by the Connecticut Health Exchange and showed that reinsurance can tangibly save money in the pockets of Connecticut residents. Why are we not doing it? There's no pride of authorship in this. The bottom line is we're trying to reduce cost. Another significant area is, sounds simple, we tax Connecticut residents who purchase health insurance policies. Why do we not eliminate that? The third area is many of our small businesses operate under 50 in the small business exchange. There's only 4 carriers in that business, and they have struggled to stay in business. We've had a number of companies exit that business. Our small businesses cannot afford health insurance for their value employees to recruit and retain them. We worked in collaboration with industry, such as the realtors, the credit unions, and CBIA and Chamber of Commerce's, to be able to produce and introduce an association health plan, an innovative idea that's been undertaken in many other states to help small businesses. It is, in essence, creating an opportunity for those small businesses to buy into a collective of insurers to provide product so that they, in a program that is administered by our private insurers, to be able to provide affordable and accessible small business premium. Very excited about that. I hope that we will have true bipartisan support and give relief to our small businesses. And those are the number of areas. We have a packet that's available to all of you that explains furthermore the details that we have. But this is truly one where it's bipartisan. I truly hope it's bipartisan. And the fact is, in the past number of years, we have made these proposals. And the shame was, these proposals never came up for a vote. We hope that this year it'll be different. We hope that these ideas will resonate with the general public and reduce cost in healthcare for our Connecticut residents. Thank you.
And thank you, Senator Wong. As you just heard, the cost of health care affects everyone, every family across the state of Connecticut. We believe that a better way to affordable health care is a good idea. And we believe good ideas always find friends. This is a simple, straightforward, and reasonable approach to solving a problem that every family faces almost on a daily basis. So with that, any questions?